Hi, I'm Emily McCurdy,
And I'm Maggie Hanusek.
and for our manager leader interview, our interviewee is my mom. I chose her because she really inspires me, and I've never really asked her about what she does. So it was very interesting learning about that. But she works on the third tower of Carolinas Medical Center in Charlotte. She went to school as a nurse, became a nurse, and became a manager after working a bit with many oral surgeons that chose her to be a manager. They liked her because she had the qualities such as being well organized, knowing where everything was and how everything ran in the clinic, and she knew how to deal with difficult situations. I asked her what inspired her to go into this industry, and she said she wasn't planning on becoming a manager, she just fell into it. She wanted a normal work schedule and she liked the experience of the clinical and business side, working both. I asked her what her day to day responsibilities were, and she said managing the clinical front office staff and the business side. She deals with the budget and makes sure that all the supplies that are purchased are within budget. She also does patient care and the dental residency program, works for the residency orientation, and shows all the residents where everything in the clinic is and how it runs, and helps coordinate their schedules and clinical assessment for the staff and pair them with the doctors.
We also asked her how to identify conflict and how to handle it. She said that she evaluates the staff's body language, and if she notices bad body language, she pulls them aside and makes sure that there's no issues. If clients are not happy with the staff, she pulls them to the side, introduces herself as the manager, apologizes, and or phone calls for service recovery. Even if the patient is wrong, she says you still have to be professional and apologize. We also asked what's the most challenging part of your job. She said the business side because of the healthcare that is involved within it. The way the hospital system is overhauling residents cost restraints, what what they do is extremely hard. She also deals with reimbursements, cuts costs, and she also makes sure that they are not financially liable. But she also says that taking care of the patients is the easiest and the most rewarding. How do you deal with clients on a bad day? You have to make sure that you put yourself into their position. These people are going through a lot. Sometimes when it gets too stressful, she takes herself out of the situation before dealing with the patient. What characteristics do you need to fulfill this position? You need to be well organized, practice work-life balance with the staff, recognize staff accomplishment, be compassionate. You have to be overall rounded. Can't expect too much from the staff. You have to walk the walk to talk the talk. You can't expect other people to do what you can't do. Be a people person and knowing what to expect from all of your employees. We also asked, what is the most rewarding part of your job? She says when patients walk out happy. She also helps with prosthetics like missing ears or nose and roofs of their mouth. Taking care of them and hearing that the staff was outstanding is very accomplished to her. Helping them recover from a hard life challenges is awesome too, and she also stays in touch with her clients.
So overall, becoming a manager, you really have to be responsible. You have to be organized and just being the best you can, and just make sure the whole organization you're involved with is running smoothly and making sure all problems are done. Fuck.